What is up, y'all? It is Dr. Tyler Kalasi, and today we are going to be talking about pinchy hips and squatting. What might be causing the pinchy hip, what exercises to do for specific causes or potential causes, and how to adjust your squat to make that pinchy hip go away. When it comes to pinchy hip or pain in the front of the hip when you're in hip flexion, there's a few different causes and we can break them up basically into two categories. The first category is going to be an actual structural change or deformity. This is something like a bony deformity or change in the shape of your hip joint. One of those could come from the way you move across life over many years or many weeks or many months can change the shape of the bone. That's kind of normal part of human nature. The other one, you could be born with slightly differently shaped hips that could prevent you from getting in deep of hip flexion as other people. And again, that is normal and can be adjusted for. The other category is going to be more movement based. So maybe you have poor control at the bottom of your squat or less than desirable core strength, which causes the hip flexors to have to compensate. Or maybe you don't have as good single leg strength on that leg, once again, causing some compensations to handle. We're gonna cover many potential causes and what to do specifically if you have that potential cause. As always, it's important to note that this video is not providing medical advice or intended to help you diagnose a specific issue. If you feel like you have an issue that needs special attention, I highly suggest going to see a physician, a physical therapist, or a chiropractor to get that attention. Realistically, if you do have a structural change at the hip, like a bony change in the shape of the joint or torn labrum, there's not much we can do to reverse that other than surgical intervention. But we can make adjustments in the setup or positioning of your squat. And we can do some corrective or priming exercises to put you in a better situation so that those things don't bother you or limit you. So this first test is for hip flexion. And not only is it gonna tell you side to side differences in hip flexion mobility, but it's also gonna tell you what angle your hip likes to be in flexion the most. So we're gonna start by laying on your back. You're gonna take one hip, one leg, holding onto it by the knee. And you're just gonna bring that hip up as far as you can. Be sure not to let your lower back or your pelvis move too much. So we only want hip movement to come from the hip. You're gonna stop when you feel a limitation and take note of how far your knee is from your chest. And then we're gonna come out a little bit, maybe 10, 15 degrees, and see if you can get more hip flexion or if it feels better. Good, so that's the middle. And then we're gonna come out a little bit further. And once again, seeing if you can get further into flexion or if it feels better for you. And we're gonna compare side to side. Essentially, after doing the test, you're going to understand what angle your hip likes to be at to be the most comfortable in deep flexion that's required for the squat. So after assessing hip flexion, we can tell if the hip flexion mobility or range of motion is the same on one side versus the other. We can also see where our hips like to be positioned in order to get the most comfortable flexion. So for me, my right hip liked to be turned out a little bit more than my left hip. I noted that because when I did hip flexion in the middle angle, right? So not this one, but when I came out about 10 to 15 degrees, that's when I felt the most comfortable. So that's where I'm gonna squat. And maybe down the road, I can try to change that so my hips are more even. But to be honest, we all have some unevenness from side to side. So we might as well kind of accept it and not try to go too hard with trying to change it. So setting up my squat, my right foot's gonna be turned out a little bit to accommodate that test that we did for hip flexion. The left foot's gonna be slightly more angled forward. And then I'm gonna be able to get deeper without pinching or feeling as much pinching at that right hip. Now let's say during that hip flexion test, every single angle was painful. They all bothered you, they all felt pinchy, you just couldn't find relief there. That hip is really hot. I like to use a banded distraction or a banded hip mobilization, whatever you want to call it, to try to calm down the tissues in the front of the hip, maybe create a little bit more space and potentially give you more hip flexion range of motion immediately afterward. To set up for this banded hip distraction, we're gonna put a band around a stable surface, usually a squat rack, somewhere between hip and knee height. I'm gonna step into the band with one leg or the other, and then we're gonna bring that band up to my hip crease, basically where my hip bends, and I'm gonna come down onto all fours and walk out until I feel some good pressure with that band. Now this is where We're gonna create some more space, relax some of that tissue in the front of the hip. I'm gonna get to where I have some pressure, and I'm gonna rock back and forth into hip flexion and back out of hip flexion. If you want, you can slightly change the angle of pull by just turning slightly so that the angle is pulling more towards the outside. It's going to be a preference thing, whatever is comfortable for you. So we've taken a look at hip flexion range of motion. We've used the band as distraction to improve the space and comfort at the front of the hip to give us more hip flexion. We want to take a look at another stretch, which is called the pigeon pose or a modified pigeon pose, to help put that joint in a more centered position. You see, the hip joint is a ball and socket joint. And when it's moving through flexion, extension, and rotation, we generally like that ball to sit kind of in the center of the socket. Now that is done by the support of ligaments and capsules and muscles and tendons, but sometimes due to life and things happening, the position can get a little off center. And that off centerness, AKA when the hip ball is a little bit more towards the front and it won't slide back enough, it can create a little bit of a pinching sensation in the front of the hip. This modified pigeon stretch is a great way to help kind of center that ball and socket joint of the hip and maybe give you more space for deeper hip flexion with your squats. We've all seen the pigeon pose where folks lay their leg out in front of them and they somehow manage to get their butt to the ground, but I certainly can't do that, and I'm gonna assume that many of you can as well, so we're going to do a modified version. So here's the step-by-step process to get into this modified pigeon pose to stretch out the posterior side of your hip and get that hip to be a little bit more centered. You're gonna get into a push-up or a plank position. You're gonna bring the one leg up that you're trying to address, and then we're gonna turn that leg in. Now in this position, I'm gonna slide my back foot back, essentially sliding my body towards my back foot until I feel a good stretch in that butt cheek of the hip that we're trying to address. And I'm gonna hang out here. You should have some nice muscle activation around the hip. You shouldn't be passive and just kind of hanging out there, but you're gonna sit in this position for 20 to 30 seconds, creating some space on the back side of the hip, allowing that ball and socket to slide back a little bit more towards the center so you can be more comfortable in hip flexion. So as I mentioned in the beginning of this video, there could be a lot of potential causes for that pinchy hip sensation you get when you are squatting. We've taken a look at hip range of motion. We've talked about structural changes or structural deformities. We've also talked about the centering of the hip joint and the hip joint mobility itself. But what if that hip pinching is coming from the hip flexors being a little cranky, from compensating or doing too much work because other areas aren't doing their job during the squat or at the bottom of the squat? One of those areas could be the core, the abdominals, the midsection, whatever you want to call it. The hip flexors are very close and basically part of that core. And if the abdominals are not appropriately bracing the spine and the pelvis, well, the hip flexors are going to try to help out. And if they help out too much, they're going to get really tight and guarded, and it's going to feel like that hip is pinching. So what do we do? Well, we need to do an exercise that strengthens the core and maybe just improves the coordination and working togetherness of the abdominals and the hip flexors. And that exercise is a dead bug. We're going to start by laying on your back. And you're going to get both legs up in this 90-degree bent position. Bending the knees instead of having them straight shortens the lever arm and makes it a little bit easier on your hip flexors to start. So we want to find a comfortable position. You don't need to have your back touching the ground or this crazy arch, just somewhere in the middle. Create some tension in your abdominals, and then you're going to lower one leg down while trying to maintain that position you started in at your midsection. What we're doing here is teaching the abdominals to do their job of bracing the spine and keeping some sort of neutral position at the core. Well, the hip flexors work on allowing the femur and the leg to move. It's basically teaching each region, each group of muscles to do their job separately. The other added bonus of a dead bug is if you've got some guarding or tone or tension of those hip flexors, moving through that dead bug is going to load that muscle and that tissue, which may help to actually relax it and reduce the pinching sensation right then and there. We worked on core strength so that the abdominals and the core can do its job and the hip flexors can worry about doing their job. But what about the hip extensors, the glutes? What if they're not doing their job as well as they could? Well, instead of the glutes lowering you into that squat eccentrically, we find that the hip flexors try to pull you down into the squat, creating stability that maybe the glutes aren't doing for you. A good way to improve how well the glutes do their job during the squat is by using a step down. Quite literally, you're going to stand on a low box or a couple of plates and step down. Essentially, we're working on a single leg squat. This is going to be great because it reduces the range of motion of the single leg squat to allow you to not go as deep into hip flexion where it's bothersome. But it's also really forcing some good hip stability and glute control and glute strength, which is going to carry over into an even stronger squat. The goal here should be to work up in height of a squat or plates until you can do a step down from a box that is basically knee height, because it's going to bring you to the same amount of hip flexion that's required during a squat. So we've talked about plenty of ways to specifically address the hip joint and the musculature that surrounds the hip. But what if you're squatting and you get a pinchy hip and you want to be able to just modify that squat in the moment to try to reduce that pinchiness right then and there? My first piece of advice would be to get yourself a pair of weightlifting shoes or just a couple of 5-pound plates to elevate your heels, put your ankle, knees, and hips in a slightly different position that allows you to go a little bit deeper without bothering the front of your hip. My second piece of advice would be to reduce the depth of your squat. Do a box squat starting with a pretty high depth. If it hurts to go deep into hip flexion, don't go that deep. Over time, as you're addressing specific points that we've talked about in this video, you can work on getting deeper into the squat. My last piece of advice would be throw a mini band around your legs for the first couple of sets. That mini band provides a little bit of resistance to help bring some awareness to the glutes and the hip musculature, create some more activation around those hip joints, which may allow the hip flexors to calm down a little bit so that you're not getting that pinchy sensation at the bottom of your squat. Well, there you have it, guys. We've covered pinchy hips with squatting, how it may be happening, why it may be happening, how you may address it, and how you may adjust your squat to bring some more comfort so you can really load that thing up and be heavy and have fun. If you have any more questions about your own specific hip discomfort, certainly drop a comment below, shoot me a message, and I'll be sure to respond or make an additional video in the future. Thanks, guys. Have a good day.